Hi, my name's Dulcie Hill, and I want to talk today about appointment I had at Johns Hopkins, and I asked about 30 minutes of my appointment time. I was asking questions for the purpose of making this video, understanding a little bit more about rituximab versus ocrelizumab and secondary progressive MS, as well as relapsing, remitting, and different treatments. So she kept wanting to talk about me, and I kept asking her specific questions. Well, the first question I wanted to know is Ocrevus or rituximab, is it good for people for relapsing, remitting? And Dr. Mowry at Hopkins said that's exactly who it's best for, somebody with an active disease. It helps those who have inflammation, which helps the disease be active. So ideally, that's who wants to take it. However, and then we started talking about the safety issues. Now, the makers of Ocrevus are also the makers of rituximab. So there's a little bit of a conflict of interest with the insurance not covering rituximab, but for MS, but covering Ocrevus when she says she's been treating patients with MS for 10 years successfully with rituximab. She loves it for the use of MS. She sees people going in remission. It's the best medication in her opinion. However, a lot of people don't have insurance that covers it, and if they don't, then Ocrevus is the only game in town. All right, so this is really, she still hesitates with people jumping on Ocrevus. There's a lot of hype going on. And again, Genentech is the one who makes it, the drug company. Their studies differ from the independent studies of multiple sclerosis centers there. So with that said, Ocrevus and rituximab are monoclonal antibodies used to help an active disease. For those of us with secondary progressive, or for those people with primary progressive, which it improved, which it is approved for, her feelings were extremely hesitant about it actually being beneficial for primary progressive. She says a small group of those with inflammation in their primary progressive disease, it will help. But those people who have primary progressive without inflammation, I'll need probably another 20 minutes to define exactly what I mean by that, but I'm not going to do that. I want to get to the point. So she thinks that if you have a breast cancer history, or it runs in your family, you've got to have your mammograms if you take the Ocrevus and weigh out your risk. Are they acceptable? Now, the second thing I wanted to talk to you about is secondary progressive and active secondary progressive. And I asked her, are there statistics? Because secondary progressive, classically, your disease is now in remission. Now, our disease is not active anymore, which means that Ocrevus and Rituxan won't work to make us feel better, prevent us from getting worse. What we're getting worse from is the damage that we had on some of the attacks when we had relapsing, remitting. So you people with relapsing, remitting, you don't have to worry about having a terrible attack and that eventually being the damage that you're going to see deteriorating for disability in the future. That may not happen. It's kind of like Russian roulette. It's going to pick and choose which lesions or exposed nerves are going to deteriorate. So that's good news. Now, with active MS, active secondary progressive MS, which is what I have, and I need Rituxan because when I'm not on medication, the old damage is getting worse in that secondary phase, and I'm still having new attacks that could get worse in 10 to 25 years, which is the typical. That's what happens in chronic progressive MS. She still has hopes that people with active MS, active secondary progressive MS, will eventually see less disease activity. But until then, if you know your disease is active and you can look back on the medications you take and you know you've had exacerbations while on the medications, then these drugs may be a very good option for you. Will they make you feel better? If you have progressive, chronic progressive, no, it's not going to make you feel better from the damage that's already happened. Another question I ask, how many people are actually active secondary progressive? Well, since that term, they've discovered, they made that category, that term, in 2013, they don't have statistics on it. So I think that I'm one of the first patients who started asking a lot of questions about what kind of role does this play and what kind of medications do we need to take. First of all, if you have relapsing remitting, it's in my opinion that no regrets, leave no regrets at the end of your life. So look on msfrontiers.org and look at the effectiveness on each medication. At the top, there's tabs, and click the medications there, and just read down. I quoted it from the MS Society, but it's easier to read for us people with MS. I get confused easy. So I want you to do that. If you have secondary progressive MS or primary progressive MS, send me an email if you're having a hard time figuring this out, because I've spent a lot of time and talking to neurologists about the hype that I'm just so uncomfortable about people taking this without knowing the risk and without knowing the reward. If the reward is to feel better, then you're not going to get that reward. Treat the symptoms. You may need Ritalin. You may need energy stuff. You may need baclofen for spasticity. You may need Empira for walking. There's just an array of things. You may need exercise. All of which I'm encouraging, but I care about you guys. So, this MS Frontiers ministry is just blowing up, and I appreciate that, because in that 2 Corinthians 12, 8 through 10, it's I serve you through my infliction. So Paul says that's God's reason for giving people affliction, so we can love each other with our experiences, and that's what I'm trying to do here with you. See what we can do also. But again, email me if you have, go to msfrontiers.org. You'll see the resources on the left. That's the MS Frontiers support groups, where there's 1,800 people now in the medical support group with MS that we all kind of back each other up with what what has helped us through our experiences. So we don't tell you what to do. No, that's not allowed. But I want you to take advantage of that and get in there. There's specific groups for primary progressive, exclusive, and also secondary progressive MS. And there's social groups, there's diet nutrition groups, and there's exercise groups. So again, go to msfrontiers.org. You'll see where you can sign up, and look at the tabs at the top. Anyway, God bless you, and keep coming back.